Hello, I believe we are live. My name is Rosalind Young Daniels, and I'm president and founder of Black Health Matters. Are you all enjoying today? It has been a labor of love, and we're so thrilled that we have so many partners who have come together to make this all happen. And in addition to some of the corporate sponsors that you see, we couldn't be here without other community partners such as the Eastern Area Links, the Jack and Jill Foundation of America, all of these venerable groups. We have Masons. We have just so many organizations, Iota Phi Lambda, that are supporting what we do. We can't do health education and reach masses the way that we want to without having organizations raise their hand and say they are going to take this on as well. So we want to thank everyone. Now we're going to have our discussion about health equity and COVID. And we are so fortunate to have two extraordinary experts. And we're going to dialogue a little bit about what is going on and what we can expect. So, my first presenter is Dr. Jeffrey Hall. He is the Deputy Associate Director for Science for the Office of Minority Health. Now, I know in my career, I have referenced the Office of Minority Health for the majority of my documents and research papers. So they are just, again, a just wonderful resource. And he's also the director and head of the Centers for Disease Control. He's the lead health scientist for the Minority Health and Health Equity team. He leads and consults on a wide range of science, research, evaluations, and practice topics to reduce health disparities and achieve health equity. We also have Dr. Cameron Webb, currently serves as Senior Policy Advisor for Equity on the White House COVID-19 response team. Throughout the pandemic, Dr. Webb has worked clinically in the University of Virginia's COVID unit. He received his BA from the University of Virginia, his MD from Wake Forest School of Medicine, and his JD from Loyola University, Chicago of Law. So, welcome, gentlemen. Thank you for joining me.
It's a pleasure to be
Thanks
here.
for having us. Glad to be here.
So, one of the things that I hear all the time is the news media has so many different perspectives on COVID. What do you think can be said that people will actually hear? Because it's kind of background noise. We're kind of away from a lot of the sensationalism with death tolls averaging, five digits of, I'm sorry, 500 and 600 every day as we were used to. What can be shared that people could actually listen to that would be less sensationalized?
Well, I think
Well,
I think to start that. Oh yeah, Dr. Hall, take it away.
I mean, just to speak directly to your point, I think one thing that we really do want people to understand is that while people obviously have reasonable fears around COVID, this is a public health problem that the best scientific leadership, the best practice leadership, the best policy leadership is being leveraged to address. And you have a whole of government, as well as, speaking for our agency, a whole of agency commitment to working in this space. And there are scores and scores of professionals that in their daily walking in their daily practice are giving their blood, their sweat, and their strength to be able to help this nation transition to a better place. So while there is a lot of sensationalism out there about what COVID entails and about things that sort of stroke the fears around COVID, we are really working hard to make this particular pandemic one that we put behind us and that we learn lessons from, so that instead of us just sort of seeking a situation where we get things back to normal, which is where I know a lot of people want us to be, we actually surpass normal. We go beyond normal and push for a society where things are stronger, things are better, things are improved as a result of us internalizing some of the lessons that were learned as a result of us having to deal with COVID.
Awesome. Thank you. And
Yeah,
Dr. Webb?
and I would just say, I think you're right. A lot of folks have heard similar messages over the last, 16, 18 months, and it's not striking them as true. I think it's the stories of real people that make the biggest difference, what actually connects with individuals. And I think that at this point, if you talk to communities where folks have had a lot of experience with COVID, and the communities where loved ones, neighbors, coworkers have been affected by COVID, some people have lost their lives, some people have been hospitalized, some people have long COVID symptoms. Those communities, you don't have to tell them about COVID, right? They know exactly what it is and what it can do. And in those communities, more people are getting vaccinated. It's in the communities where folks feel like maybe they haven't seen as much of it, where they're not as directly connected to the impact of the disease. And I think sharing those very real stories. I always tell people, when I work clinically in our COVID unit, I'll never forget the 25-year-old Black male who was on my unit earlier on in the pandemic, who was asking me, he said, Dr. Webb, I've never had any health conditions. Why am I sick? Like, why am I sick from COVID? And the answer is that this virus is pretty unforgiving. And for everybody who thinks that they're going to be just fine, for a lot of them they are. But it's completely unpredictable about who's going to have long-term symptoms with their brain, with their kidneys, with their heart, with their lungs. And you just don't want to roll the dice on that, especially when we've got good alternatives in terms of how to keep yourself safe and protected. And so I think that's the message. It has to get really personal, has to get really down to that individual level, because as we say all the time clinically, people aren't statistics. And I think putting a real face to this is the season, is the phase of this pandemic that we're in.
So now, would I be correct in assuming that or saying that this seems to be a pandemic where you have had visibly more people of color involved at the table having conversations, whether it be leadership or researchers or physicians? There just seems to be more of a diverse set of professionals engaged in developing a response. Would I be correct in saying that?
Well, I can't say comparatively because I wasn't around for the Spanish flu, but what I know is that it certainly is a diverse group of folks, really at every step. If you go back to who is developing the vaccines, who are on the committees reviewing the vaccines, like the Advisory Committee on Immunization Practices. If you look at who's at the table at CDC rather, folks like Dr. Hall. If you talk about who's at the table in the White House with myself, or with Dr. Marcella Nunez-Smith, who's the senior advisor and leading the task force over at HHS. There's so many different folks, and I think there is a lot of diversity. But I think that that just speaks to the moment. There's a phrase, "Nothing about us without us," and so this is one of those moments where we've seen since the beginning of this pandemic the disproportionate impact on communities of color. We saw in testing, we saw in cases, we saw in hospitalizations, and we saw in deaths. And so before we even got to vaccinations, we knew there was a disproportionate impact on communities of color. And so I think that's why we've had really a clarion call for leadership from those same communities. And I think many of us and many of you are answering those calls in your respective communities. But I just keep reminding folks, the work's not done. We still need more people. We need reinforcements. We need everybody, all hands on deck. As Dr. Hall said, this is sure in all of government, all of CDC, all of America response is necessary, and that includes all of Black America.
Great. Dr. Hall?
Yes, and one thing I'll add too, I really just had to reserve myself to keep from clapping with what Dr. Webb was saying. And the level of diversity that people are seeing, it's just not optical diversity. What we've been striving for are the presence of the insights that come to the table with people such as myself and Dr. Webb. We offer lived experience, both professional and personal, that are important to include as decisions are made where work in this particular space is concerned. And rightfully, as Dr. Webb mentioned, the whole idea of keeping the people in the process has to be there. So data, as an example, is a part of the conversation that often comes up. We have the job of not just having the data be perceived as being numbers. Each number that we have to take into account represents a life. It represents a connection to a family. It represents a relationship that should not be sort of minimized in terms of its importance and significance. And I think having people at the table who represent diverse backgrounds and that come from different places is really key to first be able to help us continue to do well with the mitigation strategies that are at play, to help stop the spread of COVID, but also to help recreate society in a way that allows us to overcome some of the social and health inequities that we know are responsible for the patterns of impact that we've been discussing.
That's such a great point because obviously for us at Black Health Matters, we felt a sense of urgency 12 years ago when we launched. And so we have lived in it. And then when COVID came around, people started seeking more of our opinion. But it was kind of like, what do you call it? It's been nation time for Black folks who die unnecessarily from heart disease or from HIV. So we do hope that this is a springboard to us having a more of a commitment to diverse communities so that they can have better health outcomes. Is that what you're also saying?
Yes, that is it. One thing we have also sort of ensured was a part of the way we talk about this. Um, COVID-19 is disproportionate impacts. They represent the expression of patterns that we've been seeing for a very long time, right? And what that means is that there have been people in the field who, for decades, have been trying to call attention to some of the social and structural sources of inequity. It is just that this has been a particular context of expression where we've been able to shine a light on those inequities in a way where we're able to make movements in a way that we haven't been able to do previously. Dr. Webb, would you agree with that particular characterization?
Wow, that's just, I mean, that made my heart so warm. I mean, I feel like that we're on a precipice. I'm sorry. What was your saying, Dr. Webb?
No, I completely agree. I think it's a unique moment. And when we talk about being on the precipice, I mean, if you just look at where we are in the context of doing health equity work across our society, if you look at where we are with the efforts to improve access to care, improve quality of care, to reduce the cost of care, and then you drop in this coronavirus pandemic, I think what you realize is that the moment that we entered into, when we saw the inequities with COVID, is fundamentally a different space than we would have been 2 decades ago, 3 decades ago. This is a moment where people use the language of medical apartheid. This is the moment where people use the language of disproportionate impact or access to care and the critical need to engage the needs and concerns of communities of color. And so I think we were primed for this conversation for such a time as this. And I think that it doesn't mean that everything has gone perfectly. I think that we know that equity work is the long haul work. It is not an overnight kind of endeavor ever. But we know that we came out swinging against this pandemic for our community, and that's every public health leader that I know in communities of color. They said not the whole not in my backyard mentality, and it's impossible. I'll just say in closing, it's impossible to prove a negative, right? And that's one thing that's important for people to keep in mind. But were it not for health professionals, public health professionals, and community leaders all over the country saying we are going to make sure that Black communities have access to testing, have access to contact tracing, that we're getting vaccines into these communities. If you didn't have that mobilization from day one, I can't imagine what the death toll or the pain, even above and beyond what we're currently seeing, what we've seen with COVID, would be. And so I think there's still a ways to go, but I think that there's a lot for us to look back at and say, here, this is really an example of our community saying, we're gonna meet this challenge head on.
That is so true. When I look at how all of the organizations that have mobilized, again, Black Doctors Against COVID, Dr. Ala Sanford from Philadelphia, these are people who just said, you know what, I'm going to make a difference. And they went out and they did it. And of course, because Black health matters, right, Dr. Webb?
Right, absolutely.
I have a question here. Given the disproportionate effect on people of color, personalized medicine has influenced the COVID-19 pandemic, and it underscores the importance of vaccination and more targeted ways of preventing infection. As variants continue to emerge, precision medicine and precision public policy tailors treatments unique to individuals' own genetic history. Can you speak more about the role of precision medicine as it relates to the COVID-19 response?
Well, I'll take the first stab at that. I think that this is one of those areas where I'm really grateful that we're having this conversation in an administration that values the investment in the National Institute of Health, values the investment into science and research, because I think to your point, I think all of us who are engaged from a science perspective recognize the importance there. But I was just telling you about a 25-year-old person talking about why did this pandemic affect me the way that it did? Well, that research on long COVID that NIH is spearheading, that's going to help us get some of the answers to that. And I think that's going to dovetail directly into a conversation around, the importance of precision medicine. I think the emerging treatments that we've seen, from monoclonal antibodies to other, types of treatments, antivirals, et cetera, understanding who's going to have the best response to which one, again, that's precision medicine. And that's based not only on genotyping and knowing exactly which version of SARS-CoV-2, the virus that causes COVID, we're dealing with, but also understanding how it's going to affect and impact your body. And if you can have a test that tells you both, yes, do you have COVID, but also how would COVID affect you? I think that's the season of medicine that we're in, and I think that this is, as this moves forward, because I think everybody understands COVID isn't going to disappear, in the next couple of days, weeks, or months. It's going to be here for some time. I think that as we continue as a nation and as a world to fight this pandemic, you're going to see us bring the full armament of tools that we have, including precision medicine, to make sure that we're keeping people alive, communities safe, and really keeping this pandemic at bay.
Awesome. Awesome. Dr. Hall?
Well, I mean, I think Dr. Webb said it all in terms of the clinical, importance of the precision focus. What I'll also add is that when it comes to the occurrence of the various variants that conversations have spoken to lately, we are still in the process where we are learning. And, one thing that we continue to try to really devote energy and attention to are, questions such as how well do the vaccines that exist protect various groups, such as, people with weakened immune systems. We're also continuing to take a look at how long the protection afforded by those vaccines last. Also, when we talk about the impact side of things, we continue to, at a societal level, try to take a look at questions that, get into the space of what we're now referring to as population immunity. I think the terminology used to be herd immunity, but we kind of got away from that to make it a lot more comprehensible. But I add those particular points of emphasis too, because we all know that with COVID-19, it is an inherently sort of contact-driven disease. It's a social disease, if you will. And so when we talk about the concept of clinical medicine, what we have to also be very attentive to is this linkage between what we require uniquely as individuals and how our social connections to our families, to our children, to those we have to provide care to those who are our coworkers within the context of work that we engage in daily, how all those ties and connections and relationships and their linkages to communities and to cities and states, how all of those things come into play to shape both the protection that we get as well as the vulnerabilities that exist. And I think it's that dual focus that provides a tie to the broader space of population health or public health, as well as to generate medical intervention that is really going to be as close to being effective as is possible.
Awesome. So now we're all trying to go back to work. I know a lot of employers are starting to ask people to come in. How do we manage all of that? Some people are vaccinated, some people are not. Some we feel comfortable we should wear masks in certain environments, and maybe, we're all looking to go back to work. We're looking forward to going back to church. What are your recommendations?
So, Dr. Webb, if I can speak to that one, and this may relate back to the earlier question about some things that come up in the media. So everybody's trying to be out, right? I saw some hashtags, people like, we're outside. And I get that because we've all been inside for so very long. We all want to reconnect. We're all inherently social. And I know for myself, these walls in this little room I'm in right now, sometimes they seem like they're closing in on me, right? I want to see the faces of the people that we work with. But in being able to do that, we must continue to use the mitigation strategies that have been, pushed for use, that have been encouraged for use for the entire existence of the pandemic. Hand washing is still going to be key. We still need people to be able to use masks. We still need people to appropriately social distance. And in this new context, it is critical that people get vaccinated. This particular set of mitigation strategies are the ones that remain the primary avenues through which we seek to try to get us back to normal and to try to get us beyond normal as Dr. Webb and I both mentioned a bit earlier. So I'll mention that part in terms of just reinforcing a few of the base level things that conversations have been had about before. And to also say that too, as it relates to the different contexts of resuming normal life, decisions about specific workplaces are being made. And there has to be some granularity with that because the circumstances of different groups are variable. There have to be all kind of considerations made with respect to the prevalence of COVID in local communities and how that may influence the level of safety that might exist with respect to a given workplace or school, for example. And our agency is one of the leading agencies that has helped to try to shape the narrative with respect to that and try to adapt constantly as the environment evolves so that what we put out the door is relevant and is operationally done in a way that people can actually carry out effectively.
Okay. We have a question from the audience. It says, my son got his first dose, but the side effects were so grave that he hasn't gotten the second. What do you recommend?
Yeah, I was just furiously typing a response to that question in the chat. I'm trying to get to some of the Q&A while we're talking. So the early it depends on a couple of factors. First off, which vaccine your son received and also where he lives. But if you look more broadly, we've made it through 25 minutes of conversation and haven't mentioned specifically the Delta variant, which is emerging as the dominant variant. It spreads faster, and the early indicators are it leads to more hospitalization. So by and large, if we're talking about COVID in the United States, pretty much we're increasingly talking about the Delta variant, and that those messenger RNA vaccines like the Pfizer and Moderna vaccine, we've seen they're somewhere between 33% effective with one shot against the Delta variant, nearly 90% effective with two shots against the Delta variant. So there's a big gap there. And so I think that, what I would say is that when people are concerned about the side effects, it's not often because they feel scared of the idea of getting a headache or scared of the idea of having some joint pain, some muscle aches, or just feeling crummy for 24 to 36 hours, which is really the largest kind of side effects we tend to see, some pain at the injection site. For a lot of people, it's that they can't afford to miss that day of work, or they can't afford to, not be able to watch their kids and that sort of thing. It's the real life implications of having those side effects. And what I would say is that that's the reason why we work to ensure that folks have paid time off, ensure that there are childcare options for individuals. And I think that's kind of the important thing is figuring out what is it that's so concerning, because you can certainly manage those side effects. The difference in protection is significant, and especially with the Delta variant that spreads so much faster. We're seeing it in Missouri. We're seeing it in Arkansas. It's nothing to play with. So I would strongly encourage your son to get that second shot. And then just ask the question of what symptoms in particular is he concerned about, and talk to his health provider about how to navigate those symptoms and still get the benefit of that second shot.
Awesome. Okay. I have a question. So many young people I speak to, normally it's kind of like not the stereotype, but it's the older generation that's more or less a little bit more skeptical about what they see or what they hear. But I'm listening to the younger generation, specifically women in their childbearing years, and they don't really seem to be receptive. I don't want to generalize, but I'm hearing more young African American women saying that they are really skeptical about taking the COVID vaccine because they don't know the long-term effects on their baby or being pregnant and having kids. What would you say to that?
So I know for me, I am never going to discourage critical thinking. I mean, I'm just sorry, as a person, critical thinking is the bedrock for discovery. It's the bedrock for protection. It's the bedrock for good decision making. And so I just want to acknowledge that critical thinking is one of those things that has to be there. Um, we're at a place where we do believe that questions about aspects such as this are warranted, and we continue to look at the science so that we get a better perspective as to what the situation may be as it relates to some of the concerns that obviously people are going to have about this. I won't pretend that I didn't have my own concerns at the beginning, right? As a scientist, I freely admit I am not a physician. I knew nothing about vaccination. I didn't know there were multiple vaccines that could be administered because I had limited experience with it. And in interacting with the community, I figured out that there are others who came into the situation with a similar sort of lack of knowledge. And so not having that specific knowledge doesn't mean that you're ignorant. It just means you may come with different questions. And so I think we want to cultivate a context where people are, you know, sort of positively, constructively skeptical. And we distinguish that from the opposite, which sort of deals in the realm where people are influenced by misinformation. And we know misinformation is at a high out there currently, and we have to actually speak to the truth of the situation to be able to help put that down. But we do ask people to continue to be challenging, continue to question, because it puts us in a situation where, for with our agency as just an example, it keeps us mindful of who it is that we serve, what they care about, and what we have to be able to speak to directly and powerfully.
Understood.
Well, and I just want to put a pin in the fertility question because it's one of the most critical ones. So I want to speak to that directly. You know, these misconceptions or myths or disinformation, they come from somewhere. They don't come from nowhere. And so for a lot of people, when they refer to that concern about fertility, it's actually a direct, you know, result of a scientist from England who used to work at Pfizer who made a comment about, hey, it's possible that there could be some cross-reactivity between a protein on the placenta called syncytin-1 and a protein in the COVID vaccine. And so we should investigate that before we go giving this vaccine to everyone. That got picked up by a German scientist, and they were talking about it more broadly. Well, what subsequently, so that's what became the story of, could the COVID vaccine impact fertility? Nobody really remembered the original question or the reason for it. They just knew vaccine, fertility, and maybe I should be worried. Well, the thing is, there have been several papers written thereafter about what we call homology, the similarity between the protein of syncytin-1 on the placenta and the protein on the COVID vaccine in particular. And it's not sufficient homology that we think there's going to be that cross-reactivity or that overlap. So I think that from a scientific perspective, answering that original question, we don't see any reason why the COVID vaccine itself would negatively impact fertility, right? And so I think that's the current recommendation. The reason why the American College of Obstetrics and Gynecology, why every major medical society and organization, why over 90% of physicians, which include women of childbearing age, all have made the decision that, hey, vaccination is still the better option. But I want to contrast that with the virus, which we know causes a lot of damage to pregnant women, and in so doing, causing a lot of damage or potential harm to the unborn child. COVID has a really bad track record with pregnancy, leading to more clots, leading to more bad outcomes overall. And so it's no comparison. If you look at how folks fare with COVID vaccine, with pregnancy and ongoing fertility versus how people fare with COVID, COVID is the threat, not the virus, right? And so I think that, you know, people are, to Dr. Hall's point, I do always encourage folks, ask these questions because it puts pressure on the scientists to answer the question. Based on all of the current data, evidence, and understanding, the COVID vaccine is not a threat to your fertility. And because of that, we strongly encourage you to get vaccinated because the virus is a threat to your health as a mother or a mother-to-be. And so that's the clearest answer that I can give you. It's that every entity strongly recommends vaccination for pregnant women or women of childbearing age who one day hope to become pregnant.
Okay. Now, I think our time is slowly coming to an end, but we just want to get a sense of what else would you like to say to our audience? And again, we are comprised of health advocates. You have many members of Kappa Alpha Psi Fraternity Incorporated. You have social action chairs. It's their job to develop programming that's going to reach out into the community. It's their ability to also speak to other men and have conversations about health and wellness. What would you like to share with them?
Well, I know personally, um, you kind of keyed us up for this. The leaders that are represented here on the call, they don't just consist of myself and Dr. Webb. They consist of all the gentlemen who are affiliated with Kappa Alpha Psi. I just had a chance first to glance through some of the comments, and some of the great men that I know are there. Marcus Maud and Bertram Thomas, individuals that I went to grad school with. They are represented amongst your midst, and it is incumbent on gentlemen such as yourself to use your platforms, as I know you do, to, keep your loved ones and your communities informed. And Kappa Alpha Psi is a leadership organization and has been present in many spaces, trailblazing and helping to keep a presence, be there where leadership with regard to a topic like this is so sorely needed. So I would just encourage that this network continue to really interrogate this topic and to keep the dialogue alive in a way to help promote solid critical thinking about things such as vaccination, and to encourage people to continue to use the mitigation strategies that we talked about.
Can I
So
just also ask in terms of your office and everything that the Office of Minority Research and Minority Health offers, are there any services or resources that the fraternity could utilize?
yes, we do have several places where materials related to COVID-19 can be obtained. The easiest way to get to a concentrated source of those is to Google COVID-19 health equity strategy, CDC, and
Can we
that will
put that in
actually,
the chat?
yeah,
COVID?
in fact, Ashley or Jessica, if you're still on the call, could you please drop that in the chat for us? Um, if not, I think I can grab it myself really quickly, because if you go to this website, you'll see CDC's COVID-19 health equity strategy, and there are also links to a variety of other resources that may be very helpful for those who are interested in the health equity aspects of COVID-19.
Awesome. Thank you. Thank you. All right. And Dr. Webb, what are your closing remarks?
Well, well, first I'll say it's great that you all kind of convene this event to the men of Kappa Alpha Psi. This is really awesome that you're participating in this, and that's no small thing for me as a man of Alpha Phi Alpha to say y'all are doing a good job. So well done. But that said, I just want to close by answering some of the questions in the Q&A really quickly, because I know that every time there are questions that are unanswered, that's an opportunity missed. And so Pamela King asked, on the first and second shots the same? They should be. If you took the first dose of Pfizer, you take the second dose of Pfizer, first dose of Moderna, second dose of Moderna. It's the exact same dose in every one. Someone asked about vaccine hesitancy. Where it comes from. Yes, there's historical mistrust, there's contemporary mistrust, there's access barriers. That is the whole gamut, right? So it includes complacency, folks feel like they may not get sick. There are a lot of different dynamics at play. The key is to ask people the question why they aren't quite there yet, and do it so without judgment. And that way you'll get a better understanding of what's happening in your community. A lot of people ask about a vaccine for COVID in the future, and it's likely to be necessary. It's hard to anticipate what the needs would be, because every time a virus has an opportunity to replicate inside a human host, it has an opportunity to create new variants or mutations to the virus itself. And so, will there be a single vaccine that covers all future versions of COVID, that has, all the core pieces so it can protect us? It's possible. I know researchers are working on it, but just understand that's something that we'll continue to see and will play out over time. And the last one I'll answer was about schools, and someone brought up schools opening in the fall, and they said, what are our thoughts on children under 12 receiving the vaccine? I've got a 9-year-old, almost 10, and a 6-year-old, and my 9-year-old can't wait to get the vaccine. We've done, my wife's an emergency doctor, we've done a lot of research on COVID vaccines in children. We've poured over the data, because these are our babies. We love them dearly. And we genuinely do think that it's in their best interest from a health perspective to be vaccinated as soon as possible, because even though it's rare that children get really sick or die from COVID, we don't want our babies being those few, or that one or two. That would be heartbreaking, especially when we have something that can prevent it. And so just the same way we vaccinated them against all the other childhood illnesses that we could, we're going to vaccinate them against COVID-19, because we trust the science. And so if you have additional questions, keep asking them. Attend these sessions, go places to ask. You can go to vaccines.gov for information on where you can get vaccinated, or you can go to wecandothis.hhs.gov. And unfortunately, I don't have access to the chat because they block us out on our White House computer, but it's wecandothis.hhs.gov. It's got a tremendous number of resources, frequently asked questions, toolkits that you can use, but just another way for you to continue to play that role in your communities. We need you. You are the key to ending this pandemic. It starts in communities. And thank you for your time.
Wonderful, wonderful. Okay, so we've gotten some great resources. We had a great conversation. Thank you for asking questions in the chat. And so, gentlemen, obviously we come away from this pretty much energized about what the future holds, as long as, we know that you all are working on our behalf, the American people, to help us healthier and live a longer, more productive life. So thank you for your time at the Black Health Matters Summit in partnership with Kappa Alpha Psi Fraternity Incorporated. Have a great day.